Cold and flu, two words that we hear often, especially during the fall and winter seasons. How much do we really know about them? Are we treating them correctly, or could we be making things worse? Stay with me as I break down the causes, symptoms, treatments, and most importantly, how to prevent these common but tricky illnesses. By the end of this video, you'll have the tools to stay healthy and informed this flu season. As an internal medicine doctor with years of experience, I have treated hundreds of patients with cold and flu. While these illnesses may seem harmless, they account for millions of doctor visits every year and can lead to serious complications if ignored. Clinical studies show that seasonal influenza causes up to 650,000 mortalities globally each year. So let's get started. Let's start with the basics. What causes cold and flu? The common cold is usually caused by rhinoviruses, but over 200 different viruses can be responsible. Meanwhile, the flu is caused by influenza viruses, primarily type A and type B. These viruses spread through tiny droplets when someone coughs, sneezes, or talks. Think of this virus like a glitter. It sticks to everything. Close contacts with infected people or surfaces is all it takes. A 2021 studies in Nature Medicine confirmed that influenza viruses can remain infectious on surfaces for up to 48 hours. This emphasizes the importance of hygiene in breaking the chain of infection. Next, how do you know if you have a cold or the flu? While they share similarities, there are key differences. Cold symptoms start gradual onset. They have sneezing, runny nose, sore throat, mild cough. Cold rarely accompanied by fever. Flu symptoms start sudden onset. High fever, 38 degrees Celsius. Chills, fatigue, and body aches. Dry cough, sometimes severe. There is a reminder. So if your symptoms include shortness of breath or chest pain, don't assume it's just the flu. Studies highlight that these could be the early signs of complications like pneumonia. Most colds and mild flu cases don't require lab tests. However, in severe cases or high-risk patients like children and the elderly or those with chronic illnesses, doctors may perform specific tests. Rapid antigen tests, quick results but slightly less accurate. PCR tests, highly sensitive and often used in hospitals to confirm influenza. A patient I recently treated came with a high fever and fatigue. PCR test confirmed influenza A. Because we caught this early, antiviral treatment started within 24 hours, significantly reducing the severity of symptoms. Now let's talk about treatment. First, it's important to note that antibiotics do not work against viruses. Misusing antibiotics can contribute to resistance, a major public health issue. For cold, rest, hydration, and over-the-counter medications like ibuprofen for pain or fever. Saline nasal sprays can relieve congestion. For flu, antiviral medications like oseltamivir, Tamiflu, or zanamivir are effective if it started within 48 hours of symptoms onset. Research shows antivirals reduce flu symptoms by about 1 day on average and prevent complications in high-risk patients. Untreated or severe cases of flu can lead to serious complications, especially in vulnerable groups. Sinusitis and ear infections more common with colds. Pneumonia, a leading cause of flu-related hospitalizations and death. Exacerbations of chronic diseases. Flu can worsen asthma, diabetes, or heart conditions. An elderly patient with diabetes once came to me after delaying flu treatment. What began as flu turned into bacterial pneumonia, requiring hospitalization. Timely care could have prevented this. Prevention is better than cure. And for colds and flu, it's also much easier. Here are best strategies based on research and clinical guidelines. First, vaccination. Flu vaccine is updated annually to match circulating strains. A 2023 study in New England Journal of Medicine showed that vaccination reduces hospitalization risk by up to 40 to 60%. Hygiene. Wash hands frequently with soap for at least 20 seconds. Avoid touching your face and disinfect frequently touched surfaces. Healthy lifestyle, a balanced diet rich in fruits, vegetables, regular exercise, and adequate sleep strengthen the immune system. Avoid crowds, especially during flu season. Limit exposure to crowded places if you are at high risk. Cold and flu might be common, but they don't have to disrupt your life. By staying informed and taking simple precautions, you can protect yourself and your loved ones. If you found this video helpful, don't forget to like, subscribe, and share it with someone who needs this information. And let me know in the comments below, what is your go-to remedy during flu season? Stay healthy, and I'll see you in the next video.